Hello everyone and welcome to our health channel. If this is your first time watching our program, please remember to hit the subscribe button and ring the notification bell so you won't miss our weekly health information that we carefully prepare for you. Today, I want to discuss with you a very important and sensitive health topic that has recently gained significant attention due to international news. Just recently, international media reported shocking news. Former U.S. President Joe Biden has been diagnosed with prostate cancer. This news immediately sparked widespread concern and discussion around the world. You might think, if even a former U.S. president who has access to the world's best medical resources and most professional medical teams cannot avoid the threat of prostate cancer, shouldn't we ordinary middle-aged and elderly men pay even more attention to this issue? Biden is already 80 years old this year and has been active in politics for decades, having experienced many storms and challenges. However, in the face of disease, everyone is equal. Whether you're a president or an ordinary citizen, regardless of how much wealth and power you possess, prostate cancer can strike anyone. This is exactly why we're focusing specifically on this topic today. Actually, Biden is not the first prominent political figure to be affected by prostate cancer. Looking back through history, many national leaders have battled this disease. These cases tell us a harsh reality. Prostate cancer is becoming one of the major threats to middle-aged and elderly men's health. According to the latest statistical data from the American Cancer Society, prostate cancer has become the second most common cancer among American men, and the incidence rate continues to rise annually. What's even more concerning is that most patients are not in the early stages when they're discovered. Why does this happen? The main reason is that many men lack sufficient understanding of prostate cancer and feel embarrassed to discuss or get tested for related issues. In American culture, especially among older generations, men often tend to be more reserved about discussing health issues related to private areas. Many people consider going to a urologist embarrassing, and some would rather endure discomfort than seek medical attention. However, this mindset can be life-threatening. Prostate cancer has a very frightening characteristic. It usually has almost no symptoms in its early stages. By the time obvious symptoms appear, it's often already in the middle to late stages. It's like an invisible killer, quietly growing in your body, and by the time you notice it, it might already be too late. However, I must also share a positive message with you. If detected early, the cure rate for prostate cancer is very high. According to medical statistics, the 5-year survival rate for early-stage prostate cancer can reach 100%, and even for locally advanced prostate cancer, the 5-year survival rate is over 90%. This is why early detection is so critically important. In today's program, starting from Biden's case, we'll provide detailed information about prostate cancer for all middle-aged and elderly men. We'll use the most understandable language to explain what prostate cancer is, how it develops, what symptoms it has, how to prevent it, and how to detect it early. I hope today's sharing can help more men protect their health. First, let's understand what the prostate is. Many people might not be familiar with this organ or even know where it's located in the body. The prostate is a male-specific organ, about the size of a walnut, located below the bladder and surrounding the urethra. Its main function is to secrete prostatic fluid, which is an important component of semen and plays a crucial role in male reproductive function. As men age, the prostate gradually enlarges, which is a natural aging process. However, sometimes cells within the prostate undergo abnormal changes and begin to grow uncontrollably, forming tumors. If these tumors are malignant, this is what we call prostate cancer. Prostate cancer is different from the commonly heard benign prostatic hyperplasia (BPH). BPH is a benign condition that causes urinary inconvenience but doesn't threaten life. Prostate cancer, on the other hand, is a malignant tumor that, if not treated promptly, can spread to other parts of the body and threaten life safety. So, who is more likely to develop prostate cancer? First, age is the most important risk factor. Statistics show that after age 50, men's risk of prostate cancer increases dramatically. After 60, the risk doubles every 10 years of age increase. This is why men of Biden's age group need to pay special attention. Family genetics is also an important factor. If your father, brothers, or other close relatives have had prostate cancer, your risk is 2 to 3 times higher than the general population. This is because certain genetic mutations can be inherited within families, increasing the likelihood of developing cancer. Racial factors also have an impact. Research shows that African American men have the highest risk of prostate cancer, followed by Caucasian men, while Asian men have relatively lower risk. However, with the westernization of lifestyle, the incidence rate of prostate cancer among Asian Americans is also rising annually. Lifestyle significantly affects the development of prostate cancer. Long-term consumption of high-fat, high-calorie foods, especially red meat and dairy products, increases the risk of developing the disease. Conversely, eating more vegetables and fruits, particularly tomato products, helps prevent prostate cancer. Obesity is also one of the risk factors. Obese men not only have a higher risk of prostate cancer, but once they develop the disease, the tumors tend to be more aggressive with worse prognosis. This may be related to hormone level changes caused by obesity. Lack of exercise similarly increases risk. Research shows that men who exercise regularly have lower prostate cancer risk, and even if they develop the disease, its progression is relatively slow. Exercise can improve immune function and regulate hormone levels, all of which help prevent cancer. Smoking and excessive alcohol consumption also increase the risk of developing the disease. Harmful substances in tobacco damage all organs in the body, including the prostate. Alcohol affects hormone metabolism, increasing the possibility of cancer development. Occupational exposure is also a factor to note. Long-term exposure to certain chemicals, such as pesticides and heavy metals, increases prostate cancer risk. This is why men in certain occupations need to pay special attention to protection. After understanding these risk factors, let's look at what symptoms prostate cancer has. This is the issue most people are most concerned about, because timely discovery of symptoms can enable early diagnosis and treatment. However, I must tell you a not-so-optimistic fact. Early-stage prostate cancer usually has no symptoms at all. This is why it's called the silent killer. Many patients are already in middle to late stages when diagnosed because there's no obvious discomfort in the early stages. However, as the tumor grows, patients may experience some urinary system symptoms. The most common include difficulty urinating, frequent urination, urgent urination, weak urine stream, and feeling of incomplete bladder emptying. Some patients may also experience increased nighttime urination, requiring frequent trips to the bathroom. It's important to note that these symptoms are very similar to those of benign prostatic hyperplasia, and can easily be overlooked or misdiagnosed. Many men think these are just normal phenomena of aging and don't seek timely medical examination. If prostate cancer continues to progress, more serious symptoms may appear. For example, blood in urine hematuria, which is usually a sign that the tumor has invaded the urethra or bladder. Pain during ejaculation and blood in semen may also occur. When cancer spreads to other parts of the body, metastatic symptoms appear. Prostate cancer most commonly spreads to bones, especially the spine, pelvis, and ribs. Patients may feel persistent bone pain, particularly back pain. In severe cases, it may cause fractures or spinal cord compression, leading to neurological symptoms such as leg weakness and urinary or fecal incontinence. If cancer spreads to lymph nodes, it may cause leg swelling. If it spreads to the lungs, symptoms like cough and difficulty breathing may appear. If it spreads to the liver, symptoms such as abdominal pain, loss of appetite, and weight loss may occur. If you found this information helpful so far, please remember to like our video and subscribe to our channel. We'll continue to provide you with more practical health knowledge. Since early-stage prostate cancer has no obvious symptoms, how can we detect it early? This requires relying on regular health checkups and screening. Currently, prostate cancer screening mainly includes two items: PSA testing and digital rectal examination (DRE). PSA stands for prostate-specific antigen, a protein secreted by prostate cells. Under normal circumstances, PSA concentration in the blood is very low, but when problems occur with the prostate, PSA levels rise. PSA testing is very simple, requiring only a blood test. Generally, normal PSA value should be less than 4 ng/ml, but this standard is adjusted according to age. For men aged 50 to 59, PSA should be less than 2.5 ng/ml. For ages 60 to 69, less than 3.5 ng/ml, and for those over 70 up to 4.5 ng/ml is acceptable. However, elevated PSA doesn't necessarily mean prostate cancer. Prostate inflammation, benign prostatic hyperplasia, urinary tract infections, and even vigorous exercise can cause PSA elevation. Conversely, about 20% of prostate cancer patients have normal PSA levels. Therefore, PSA testing is just a screening tool and cannot serve as the basis for definitive diagnosis. Digital rectal examination is another important examination method. The doctor wears gloves and uses a finger through the rectum to feel the prostate, checking its size, hardness, and whether the surface is smooth. Although this examination may feel uncomfortable or embarrassing, it's an important method for discovering prostate abnormalities. If PSA is elevated or abnormalities are found during digital rectal examination, the doctor may recommend further testing. Ultrasound examination can provide a clearer view of the prostate structure, while MRI can provide more detailed imaging information. However, to definitively diagnose prostate cancer, a prostate biopsy is ultimately needed. This examination involves taking small tissue samples from the prostate under ultrasound guidance using a special needle, then observing under a microscope to see if cancer cells are present. Prostate biopsy may sound frightening, but it's actually a relatively simple and safe procedure. The entire process can usually be completed in an outpatient setting, taking about 15 to 30 minutes. The doctor will provide local anesthesia to reduce discomfort. After the examination, there may be slight blood in urine or stool, which is a normal phenomenon that usually disappears within a few days. A small number of patients may experience urinary tract infections or other complications, but overall the risk is low. If prostate cancer is confirmed through biopsy, the doctor needs to further assess the severity of the cancer. This involves the concept of cancer staging. Simply put, staging determines how far the cancer has progressed and whether it has spread to other areas. Prostate cancer staging is mainly determined based on tumor size, whether it has invaded surrounding tissues, and whether it has metastasized to lymph nodes or other organs. Early-stage prostate cancer is confined only within the prostate without spreading. Intermediate stage may have invaded tissues around the prostate. Late stage has already spread to lymph nodes or other organs. In addition to staging, doctors also evaluate the malignancy level of the tumor, which is the Gleason score. This scoring system judges tumor aggressiveness based on the appearance of cancer cells under a microscope. The higher the score, the more malignant the tumor, and the faster its growth and spread rate. After understanding staging and scoring, doctors can formulate personalized treatment plans. There are many treatment methods for prostate cancer, and which method to choose mainly depends on the patient's age, physical condition, tumor stage, and degree of malignancy. For early-stage, low-risk prostate cancer, doctors may recommend active surveillance. This doesn't mean no treatment, but rather regular monitoring and close observation of tumor changes. If the tumor doesn't show obvious growth, active treatment isn't needed for the time being. This approach is suitable for older patients, those in poor physical condition, or those with very slow-growing tumors. Surgical treatment is one of the main treatment methods for prostate cancer, with radical prostatectomy being the most common. This surgery removes the entire prostate along with the seminal vesicles, aiming to completely eliminate cancerous lesions. Currently, there are different approaches including traditional open surgery, laparoscopic surgery, and robot-assisted surgery, each with advantages and disadvantages. Radiation therapy is also a commonly used treatment method. It can be divided into external beam radiation therapy and internal radiation therapy, brachytherapy. External beam radiation therapy uses high-energy rays from outside the body to irradiate the prostate, killing cancer cells. Internal radiation therapy involves implanting radioactive particles inside the prostate to emit radiation from within and kill cancer cells. For advanced prostate cancer, doctors may use hormone therapy, also called androgen deprivation therapy. Since prostate cancer growth requires stimulation for male hormones, blocking the action of male hormones through medication or surgery can control cancer development. Chemotherapy is usually used for advanced prostate cancer where hormone therapy is ineffective. In recent years, new treatment methods such as immunotherapy and targeted therapy are continuously developing, bringing new hope to prostate cancer patients. Each treatment method has its side effects. Surgery may affect urinary and sexual function. Radiation therapy may cause intestinal and urinary reactions. Hormone therapy may cause hot flashes, osteoporosis, and other problems. Doctors will consider treatment effects and side effects based on patients' specific situations to choose the most suitable treatment plan. Having discussed so many treatment methods, the most important thing is still prevention. As the saying goes, prevention is better than cure. And this saying is particularly relevant when facing prostate cancer. While we cannot change age and genetic factors, we can adjust our lifestyle to reduce the risk of developing the disease. Diet is an important factor in prostate cancer prevention. We recommend eating more vegetables and fruits, especially tomato products rich in lycopene. Lycopene is a powerful antioxidant, and research shows it has certain effects in preventing prostate cancer. Cooked tomato products, such as tomato sauce and tomato soup, contain more absorbable lycopene than raw tomatoes. Soy products are also considered beneficial for prostate health. Soybeans contain isoflavones, which are plant estrogens that may help balance hormone levels in the body. In the United States, there are many delicious soy products available, such as tofu, soy milk, and tempeh, all of which are good choices. Green tea is also a good choice. Research has found that catechins in green tea have anti-cancer properties. High-quality green teas contain abundant antioxidants. Conversely, red meat consumption should be reduced, especially processed meat products. High-fat dairy products should also be consumed in moderation. Cooking methods are also important. Try to avoid high-temperature cooking such as grilling and frying, as high temperatures can produce carcinogenic substances. Maintaining an appropriate weight is also important for prostate cancer prevention. Obesity not only increases the risk of developing the disease but also affects treatment outcomes. It's recommended to keep BMI within the normal range of 18.5-24. Regular exercise is an effective method for preventing prostate cancer. Research shows that at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling, can significantly reduce prostate cancer risk. Exercise not only helps control weight but also strengthens immune function and improves hormone levels. Quitting smoking and limiting alcohol consumption are beneficial for preventing all cancers, and prostate cancer is no exception. If you have a smoking habit, it's not too late to quit now. Alcohol should be consumed in moderation, preferably not exceeding 1 drink per day. Maintaining healthy sexual habits may also help prostate health. Research shows that moderate sexual activity may help with prostatic fluid discharge, which could be beneficial for prostate health. In addition to lifestyle adjustments, regular screening is the most important method for early detection of prostate cancer. So when should you start screening, and how often should you get tested? Generally, men over 50 should begin regular prostate cancer screening. If you have a family history or other high-risk factors, you may need to start as early as 45 or even 40 years old. The frequency of screening depends on individual risk factors and test results. If PSA levels are normal and digital rectal examination shows no abnormalities, annual screening is generally recommended. If PSA is mildly elevated, testing every 6 months or more detailed examinations may be needed. It's important to note that certain factors should be avoided before PSA testing that could affect results. For example, avoid sexual activity, bicycle or motorcycle riding, and vigorous exercise for 48 hours before testing. If you have a urinary tract infection or prostate inflammation, these should be treated before testing. Please like our video and share this health information with others who need it. Your sharing could help many more middle-aged and elderly men. In the United States, prostate cancer screening and treatment have become quite advanced, with major medical centers having professional urologists and comprehensive facilities. However, many men still have psychological barriers to urological examinations, feeling embarrassed or ashamed. This mindset is completely unnecessary. Doctors are professionals who deal with these issues daily, and for them, examining the prostate is as routine as examining any other organ. Moreover, today's medical environment is increasingly humanized, with all medical staff placing great emphasis on protecting patients' privacy and dignity. If you have concerns about screening, you can first discuss with your family doctor or choose a urologist you trust. Many medical centers offer comprehensive health screening packages that include prostate-related tests, which might feel more natural. In addition to regular screening, you should also pay attention to signals your body sends. If symptoms such as difficulty urinating, frequent urination, urgent urination, or blood in urine appear, don't assume they're just normal phenomena of aging. Seek medical examination immediately. Family support is also very important for prostate cancer prevention and treatment. If you're a spouse, pay more attention to the male family members and remind them to get regular checkups. If you're an adult child, also pay attention to your father's health and accompany him to medical examinations. For patients and families who have already received a prostate cancer diagnosis, please don't panic excessively. Current medical technology is very advanced, and the cure rate for early-stage prostate cancer is very high. Even for intermediate to late stages, there are many effective treatment methods that can control the condition well and allow patients to maintain a relatively good quality of life. During treatment, patients' mental health is equally important. You can seek help from professional counselors or participate in patient support groups to communicate with people who have similar experiences. Maintaining a positive and optimistic attitude is very helpful for recovery. Nutritional support during treatment is also important. Treatment may affect appetite and digestive function, so paying attention to nutritional balance becomes even more crucial. You can consult with nutritionists to develop personalized dietary plans. Exercise during recovery cannot be overlooked either. Appropriate exercise helps restore physical strength, improve mood, and may reduce treatment side effects. Of course, exercise intensity and methods should be adjusted according to medical advice. Returning to the Biden prostate cancer incident we mentioned at the beginning, this case tells us that prostate cancer can really happen to any man, regardless of wealth or status, regardless of professional position, but it also tells us that even elderly patients can still have good prognosis if detected in time and treated actively. Biden's courage as a public figure to disclose his condition greatly helps raise public awareness about prostate cancer. His bravery also tells us that having prostate cancer is not shameful. What's important is facing reality and actively pursuing treatment. The United States has many excellent medical resources and professional doctors, and the level of prostate cancer diagnosis and treatment has reached international advanced standards. Medical centers like Mayo Clinic, Johns Hopkins, and Memorial Sloan Kettering have professional urologic oncology departments with advanced equipment and sophisticated techniques. At the same time, American health insurance systems also provide good coverage for prostate cancer patients. Most examination and treatment costs are covered by insurance, greatly reducing patients' financial burden. Finally, I want to emphasize several key points again. First, men over 50 should receive regular prostate cancer screening, which is the most effective method for early detection. Second, maintaining healthy lifestyle habits including balanced diet, regular exercise, weight control, and smoking cessation and alcohol moderation can reduce the risk of developing the disease. Third, don't avoid screening because of embarrassment or fear. If prostate cancer can be detected early, the cure rate is very high. Fourth, if unfortunately diagnosed, don't despair. There are currently many effective treatment methods, so trust your doctors and actively cooperate with treatment. Fifth, family support and understanding are very important for patient recovery, so we should use love and care to help patients overcome difficulties. Prostate cancer is frightening, but it's not unbeatable. With sufficient knowledge and the right attitude, we can prevent and respond to this disease effectively. I hope that through today's sharing, more men can protect their health and eliminate fear and prejudice about prostate diseases. Health is our most precious asset and should never be neglected at any time. Starting now, let's pay attention to prostate health together, get regular checkups, live healthy lives, and create a better future for ourselves and our families. Thank you for watching today's program. If you found this information helpful, please be sure to hit the subscribe button and turn on notifications so you won't miss our future health information. Also, please share this video with others who need it, especially those with middle-aged and elderly men in their families. Every time you share, you might help a family or even save a life. Remember, prevention is better than cure, and early detection and early treatment are the best weapons against prostate cancer. See you next week and stay healthy.